This is Dr. Nayak here from Survivorscourse, and I just want to give you a brief outline of the program. The Survivorscourse offers a Step 1, a Step 2 CK, and a Step 3 program. The entire basis of the program is to make sure the students really understand the concepts of basic sciences and medicine and management as they go along. The problem with the Step 1 basic sciences is a student already starts reading for the exam thinking, I have a lot to memorize, I have a lot of details I need to know. We at the course tell you we don't need to know that many details because you need to understand the science behind the basic sciences. For example, a student picks up a vignette, student picks up an explanation, student picks up a guidebook, and they try to read a Councilman body, they try to read a Carl Exner body, they try to read a Ben Jones protein, they try to read something else tomorrow. But you need to understand any cell that has a eosinophil in it is an apoptotic body. So it doesn't matter if it's a Councilman body, a Carl Exner body, a Ben Jones protein, or a Hertel cell, it's still an apoptotic body. For example, anything that rapidly divides needs tyrosine kinase receptors. So tomorrow they say the patient has a glioblastoma, he's not going to live too long because it's such a rapidly proliferating cancer. Maybe the glial cells express tyrosine kinase receptors. Then it gets turned against you. Then they say osteosarcoma is so malignant, it divides so rapidly and the patient doesn't live for more than a few years. Maybe the periosteal elevation has a tyrosine kinase receptor. Then they say the Herceptin receptors in the breast are blocked by trastuzumab, which is a very HER2 positive breast cancer, is a rapidly proliferating breast carcinoma. Then how does the Herceptin trastuzumab, a novel drug, act? By blocking tyrosine kinase receptor. So you need to understand the basics behind the conceptual knowledge of the medicine. Then the Step 1 becomes very easy. Then you realize I have to memorize less, I need to know my stuff more. For example, a student reads a book and they say iron isotyl triphosphate, secondary messenger for diacyl, is a secondary messenger for cholecystokinin. When you know something like that, that is a fact. That is not a concept. But we at Survivorscourse teach you that iron isotyl triphosphate will increase intracellular calcium. Calcium is needed for contraction, so that makes sense why iron isotyl triphosphate increases intracellular calcium that contracts my gallbladder. Then I can reapply it and say oxytocin is able to contract my breast and my uterus because iron isotyl triphosphate increases calcium. Calcium is needed for contraction. It makes sense why it contracts the breast and the uterus. When you really understood what a secondary messenger was, what a primary messenger was, you spend less time in memorizing, you spend more time in understanding. The same thing when it has to get turned around. Suppose you say, okay, I have a Step 2 exam, I have a comp exam, I have a shelf exam, I have a CK exam, I have a Step 3 exam, I have a management question. You have to understand the knowledge behind it. For example, at Survivorscourse, we really rely on concepts. So we say acetylcholine and dopamine are inversely proportional. Acetylcholine is parasympathetic. Parasympathetic nervous system controls bowel and bladder. Now, how do we apply this again in our day-to-day life? Okay, the Step 2 CK management question, I'm on a shelf exam, a comp exam, a CK exam. The patient has a 3rd degree heart block. What do I give them? IV atropine. Why did I give him atropine? A trop is an anticholinergic drug. So when I stop that anticholinergic activity by giving a trop, atropine, ipratropium, triotropium is an anticholinergic. So by giving an anticholinergic, I blocked his acetylcholine. Dopamine is inversely proportional. It went up. It restarted my heart back. That makes sense to me. I can again go reapply it and I can say there's a patient with diabetic nephropathy. He's having type 1 diabetes for the last 30 years. He's very constipated. He has gastroparesis. His bowel is not moving. I say, all right, let's give him metachloropromide because when I blocked dopamine, acetylcholine went up. Acetylcholine stimulated my bowel. That makes sense why metachloropromide helped me with my gastroparesis. You again go reapply it. You say, I have a psychiatry shelf, I have a comp exam, I have a CK exam. There's a lot of psychiatry on it. Let's reapply it. They say a patient took a haloperidol. Haloperidol blocked dopamine. Acetylcholine went up. Acetylcholine works on the skeletal muscle, on the nicotinic receptors. That explains me the dystonia. Then you say, okay, let me do a pediatric question. They say the mom brings a 5-year-old child who's talking to himself, who's talking to the walls, he's talking to the television. He's gone crazy. past history includes the child has a flu. Maybe the mom gave him Benadryl, diphenylhydramine, which is an anticholinergic. She blocked the dopamine, she blocked the acetylcholine, dopamine went up, the child started having hallucinations and he started talking. I can explain medication-induced child psychosis in a psychiatry question. It is not about medicine, it's not about surgery, it's not about OBGYN, it's not about pediatrics. It is about knowing knowledge and concepts. Suppose you say, okay, the woman is having pregnancy-induced hypertension. That's an OBGYN question. Yeah, but hypertension is cardiology, that's medicine. You need to understand, okay, let me see the question. The woman is having a systole, diastole, both elevated. You say, okay, maybe the woman has a lot of estrogen. The liver started to work twice as hard. It increased angiotensinogen, so that makes aldosterone. Aldosterone went up, systole, diastole go up. But estrogen is bradycardic, so she's having bradycardia. So maybe I shouldn't give her a labetalol. Maybe I should give her a nifedipine. Now you understand how to choose between an option choice between a labetalol and a nifedipine, which are both used for hypertension in pregnancy. So when you sit on a test, let it be a comp exam, a shelf exam, a step 1 exam, a step 2 exam, a step 3 exam, you shouldn't be between two options. You shouldn't be like, yeah, well, I gave labetalol in pregnancy too. I gave nifedipine too. So you need to know exactly when to choose what, and that understanding comes when you have a knowledge. Students say that they're afraid to take a comp exam, they're afraid to take a CK exam, they're afraid to take an NBME, they're afraid to take a step 1 NBME because the only reason is the concepts are not strong. Reading facts will not give you knowledge. Understanding the concepts will give you knowledge. So that is what we do at the Survivorscourses. It's a 6-week program, 7 days of the week. We will give you all the books you need, the step 1 book, the step 2 book and step 3 book. It's just one book. We don't give you 10 sets of books. It's just one book which is completely conceptually oriented. The book is not based on mnemonics. The book is not based on shortcuts. The book is based on concepts. Once you understand it, your confidence goes up. You're ready to take that NBME, that comp exam, the shelf exam, get it done. Even the management has to be understood in a very conceptual manner. Like for example, we tell the students, if you have a duct or a gland in your body, do an ultrasound because ultrasound will help you visualize a gland or a duct. So tomorrow I go to my test, let it be a shelf or a comp or a CK or a step 3. The patient has a thyroid adenoma. Thyroid is a gland. Let me order an ultrasound. Maybe the other guy has a parathyroid adenoma. Parathyroid is a gland. Let me order an ultrasound. Maybe the patient is having a primary biliary cirrhosis, which is a duct. Let me order an ultrasound. Secondary biliary cirrhosis. Let me order an ultrasound. Sclerosing cholangitis. Let me order an ultrasound. By understanding exactly what the tools of management do, you're able to answer so many questions without memorizing any explanation of a question or just memorizing a book on a management, because you exactly knew why you were managing in a certain way. So that is the whole aim at the Survivorscourse, is to actually teach you and make you understand rather than to memorize mnemonics, memorize explanations, memorize flow charts, so that day when you sit on a test day, you just click and then you go on with your life. The course runs 7 days of the week, 365 days of the year. It's a 6 weeks program. You get 6 individual one-on-one tutoring sessions with a personalized tutor. They spend 1 hour each with you and they help you enforce test taking skills. The course runs from 4:15 Eastern to 9 p.m. Eastern. The first 1 hour of the course, 1 hour 30 minutes of the course is spent only on test taking, where I personally share the screen with the students, teach them how a test question is to be processed, how do you get information of the test question, so that when you sit on a test, you're not changing options. You should never be between 2 option choices. The test just wants the one option choice, which is the most correct. Then followed by that, you'll have the lectures. Paperback copies are sent to your home. You will have access to ebook copies if that's what you like to read, if you're not a paperback reader. You'll also get pharmacology audio recorded lectures, where you can actually understand pharmacology, then memorize a mnemonic. For example, you have a metformin. If you read a book for a quick review, or either you just read a book for explanation, it says metformin inhibits gluconeogenesis, reduces blood glucose, adverse effect, B-complex deficiency. When you read something like that, you're basically knowing a fact about metformin, but you don't know metformin itself. The way we do it in a pharmacology recording is metformin inhibits B-complex. B-complex is a cofactor for gluconeogenesis, that is making sugar. If you block B complex, you can't make sugar. So it makes sense why blood glucose goes down. It also makes why metformin causes a B complex deficiency, because it's blocking B complex, a cofactor for making sugar. So you need to understand your drugs. Once you get a conceptual knowledge, you're good to go. So that we provide you with the online access for your pharmacology recordings. We give you a course notes so that when you sit in a program, you're focused on listening, because your frontal lobe is only going to record what you listen, not what you write. So you don't have to take any notes down. Everything that is told is in the book. You'll have 6 individual one-on-one tutoring sessions where the tutors will guide you through. We have a special tutoring session only with biostatistics tutors, because we hardly see someone who loves biostatistics. So the biostatistics should be a breeze on the test. We make sure that we take care of you everything all along the way, as long as you're ready to put the work for getting it done. And for the step 3 program, we go a week beyond, where I personally sit with the students and do the CCS cases. The only problem a student has on a CCS case on the day 2 of the step 3 exam is the student focuses more on what they memorized and the protocol of the management was than the actual management was. Like for example, if I say I have a 70-year-old man in my emergency room and he's having a sigmoid diverticulum, I do everything right. I say do the airway, do the breathing, do the circulation, give him the pain medications, prop his bed upright, make sure I give him advice about alcohol, about smoking. That's one end. But the CCS basically focuses on what are you going to do that is the most critical. Suppose if I did everything right, I checked his blood pressure, I gave him the pain management, I done his blood work, I made sure I propped his bed right up, I told him to exercise, I said that's one end. But that's not all at one end is not going to make you pass the CCS case. The only thing that's going to make you pass the CCS is he has a sigmoid diverticulum, did I do a sigmoidoscopy? So on the CCS cases, we make sure that we know how to make sure that you pass it, but we also focus on how you don't fail it. That is the key of getting out of the CCS. So I personally sit 1 week with the students and make sure I perfect you on the CCS cases, so you know exactly what had to be done to pass it, what had to be done not to fail it. So that is a very different approach we use at the Survivorscourse, is how not to fail a CCS case. That's very important. The Survivor's Guide will always provide you with the Survivor's Guide to Step 1, which is basically aimed and geared towards a management book. So you don't need a substitute, where you actually understand the basic sciences than to memorize it. We have the Step 2 CK book and the Step 3 book, which is basically geared specifically for your exam so that you understand your management. All the books provided to you will come with a specific topic on principles of management and test-taking skills, which are very important to boost your score, and that way you'll understand how to manage something, why you're managing something, and how to process those very long vignettes in a quick period of time. You will also have the quick review books, which is basically a quick review of high-yield concepts. We do not pride on clue words and buzzwords. We pride ourselves on concepts. So the quick review book for the Step 1, the Step 2 CK, and the Step 3 will basically have a quick review of the high-yield concepts. So if you're giving a comp exam, a shelf exam, a management exam, a CK exam, a Step 1 exam, or a Step 3, and you want to quickly review your high-yield concepts, you can even access our quick review book for the Step 1, Step 2 CK, and Step 3. The basic sciences are the most crucial steps, because that will build your foundation for your management exams, for a PLAB exam, for a Canadian exam, for a USMLE exam. For example, if I did my basic sciences and I said magnesium has two positive charges, sodium has 1 positive charge. So when I give magnesium, like a magnesium sulfate infusion, which is 2+ charge, it travels faster along the electrochemical gradient, blocking sodium, which is a concept of a basic sciences. Let me reapply it. The woman has a preeclampsia, she's pregnant, she's 24 weeks pregnant, she has a preeclampsia. Let me give her a magnesium sulfate. Why? Because a seizure means rapid depolarization of the brain by sodium channels. Let me slow the sodium down. What do I give to compete with sodium? Magnesium, because it's 2+ charge. So I gave them magnesium. Magnesium has no capacity to carry electrical current in your body So that's why it will block the sodium. It doesn't carry electrical current in my brain. It slows my brain down. It treats my seizure. Let me reapply it. If I give too much of magnesium, I block too much of sodium. That is the reason when I give too much of magnesium sulfate, I had absent deep tendon reflexes, absent ankle jerk reflexes, because I block so much of sodium in my brain that I have no more reflexes. So I can reapply it saying this is obstetrics and gynecology or female reproductive system and my management. Let me go back again to reapply it. I have too much of sodium in my heart. I could have a cardiac arrhythmia. I could call it a torsades. What am I going to do? I need to slow my heart down. Why did my heart get so fast? Because of rapid depolarization, sodium gave the electric current. What am I going to do? Give the magnesium, block the sodium, I treat my cardiac arrhythmia. So that's a reapplication into your cardiology. So the basis of the entire Survivor's course is you actually understand the concepts, then just memorize the details about a torsades or a preeclampsia or an eclampsia. So that day when you walk into a test day, you knew exactly what you were clicking, why you were clicking, without changing answer choices and without being between two options. With the Survivor's courses, we encounter a common issue where the student says, I'm in a bad rotation, or I don't have enough time for my test, I'm just 3 weeks away from my exam, I'm 1 week away from my exam, or I'm in a bad rotation where I have a night shift, or I'm not able to do the program for some other reasons. So we also provide you on-demand lectures, which are basically designed by me. I've done all the on-demand lectures, and in case you run out of time, suppose you say I just have 2 more weeks left, then we also give you a personalized quick sessions for your test taking skills for those last 2 weeks. You can also have our on-demand lectures which are available on the website in case you run out of time or the situation doesn't suit you to sit in a 6 weeks program. Then you can always access on demand for the step 1, the step 2, the step 3. The on-demand lectures are updated very frequently so that we make sure that the quality is kept through it in case you're not able to meet us in a program. The Survivor's course also helps with students who practice for the Canadian entrance. The Canadian exam is basically a same platform of integrated medicine with management. And it is again a very conceptually based exam which basically has the MCQE1 and the multiple choice questions, which are about 210 questions, which are again based on the foundations of medicine. Once you know your concepts of the medicine, those 210 questions along with your Canadian specific ethics and biostatistics should be a pretty ease. We also make sure we spend our integrated time for 1 week for the CDM cases, which come to around about 38 cases. We basically make sure the main focus on having a success on the CDM case is not just how to pass the CDM case, but also how to make sure that you don't fail it. So we make sure that we spend a 1 week integrated time personally with you on those CDM cases, and that is basically the Survivor's course will do its best and beyond to make sure you get through the Canadian exams. You have your Canadian tutors who have basically taken the exam, who will help you guide you through this process personally when you join the course. We have a 6-week program at the Survivor's courses for the PLAB UK exam. The PLAB exam is basically a simplified exam of conceptual knowledge of medicine. Once you understand the base knowledge of medicine, you will be able to answer questions in integrated topics. Once you understand cardiology, you will be able to understand how do I treat a pregnancy-induced hypertension. Once I understood neurology, I know how to treat preeclampsia and eclampsia. So the entire program is based on a conceptual knowledge that once you master your concepts, you're ready for the PLAB. The course will basically provide you a PLAB book, which is the Survivor's Guide to PLAB 1, which will basically have all the conceptual knowledge and which are the course notes. You will also be provided with a quick review book for your PLAB, which will be paperback copies, which will be delivered to you. If you prefer to read an ebook copy, we'll have an ebook copy ready for you. But the entire course will make sure that when you walk into that exam, you really understood medicine rather than just memorize a management or a medicine. We at Survivor's courses want to make sure that not just your step 1, the step 2 CK, the shelf exams, the comp exams, the step 3 exams are a journey, but we went a step beyond to make sure your OET is taken care of. We keep hearing that the CS got replaced because of the COVID and all the crisis we are going through. but it's always better to be safe. But we also need to make sure that our education is taken care of. So we have expertise and tutors who work with you to make sure your skills on your OET is trained. A lot of the students, unfortunately, would have taken an OET more than once. So if in case you wanted to work with our tutors, we'll personalize sessions with you to make sure we enhance exactly what your weaknesses was on your previous OET so that it doesn't repeat the next time, because we don't want this to be a hurdle during the pandemic. With the Survivors courses, the privilege I have is that I work with you extensively for 6 weeks because I do all the topics of the courses. I do cardiology, I do neurology, I do gastroenterology, I do general principles, general pathology, management courses, CCS courses. So I have an extensive work where I've spent almost 4.5 hours with you a day for 6 weeks. So I know exactly how you are. I know what tailors to your needs. I know what is your background. I know what you went through in your past. So we also go ahead and I personally make sure that I write you a perfect personal statement that suits with what your background was, with what your issues were, so that when you apply for residency program, they know exactly what happened and how to get beyond it. So we also offer personal statement support. And I personally make sure that I sit with the student, have a conversation with them, and write them a personal statement that suits exactly them. With the Survivors courses, you will work with tutors who have already passed the course with us. We also have the same tutors who are matched into a residency program of their choice, which they always wanted, in the university that they always wanted, in the hospital they wanted to work. So we also have a program where in case you need a mentor, you need some direction, you need some help on exactly how to apply for your residency program, what programs you should apply for, what score fits into what application you can put in it, how to put in an application. We make sure that we give you a private resident consult of the students who have been through the course and in a residency right now in an active residency program, so that they work with you personally and guide you through this process. So that way you will have a better guidance in what you want to get into, how to get into, and how to pursue. So if you need any more information about the Survivors courses, please go ahead, go onto our website, survivorscourses.com. You can even find my personal email there, vijaynayak@survivorscourses.com. You can know my background, what I have done, why I started the program, what we do in the program. If you click About Us, you can also personally go ahead and text me or WhatsApp me on 610-883-0673. We have a whole team that will take care of you.